During times like today, when we have pandemics and viruses spreading across the entire world, affecting millions of people, having health regulations is a huge concern for everybody to be as safe as possible. Having trust to the government is something that is very important for us to understand and be able to maintain so that less people can be affected and less people can die due to these horrible conditions. Credible, reliable, and consistent information to the public, as well as health professionals and decision makers, is crucial to help navigate uncertainty and risk in these times of crisis and concern. However, not all people trust what the health officials have to say from the government. Xander Landon from Newsweek wrote that around half of surveyors state that they do not trust the CDC. Many people do not like being told to change their ways, such as wearing masks or being restricted on where they can go. Also, incomplete or lack of communication entirely can deter people's opinions. The Center for Disease Control and Prevention is a company that is a federal company that tries to gain information about public crises such as COVID-19 and inform the public about the information so that we can stay as safe as possible and give us guidelines to do so. But in these times, the lack of communication, their inconsistencies, their political overviews in their articles before they're being published, and other groups creating more information that is more reliable than the CDC has caused concern for their trust. And today we're going to talk about why the CDC is to not be trusted. The CDC's pledge states that they base all public health decisions on the highest quality scientific data that is derived openly and objectively. However, there comes a violation of integrity when the CDC is allowing politicians to review their reports before they're being published. They're not being transparent about who is reviewing or how the reviewing process is going on to the public before it happens, and so we do not know if the information is being altered or changed to sway one side or the other in an unbiased, fair information report. Furthermore, on top of their articles not being completely accurate, possibly, the CDC's inconsistency during the wild pandemic has caused a lot of lack of clarity and trust between the public and the government. The lack of clarity of approach in several announcements from varying agencies and pharmaceuticals has raised confusion for many, which deters the lack of communication and trust between what is correct, what isn't correct, and the mix in between if many different things are being stated in different ways. For example, during the hottest time during the pandemic, many of the schools were being shut down. Some agencies were saying to shut down schools entirely, while many said that they cannot do that, to have that 6 feet rule. And many were confused about the expectations of the 6 foot rule and how that would be possible while maintaining a normal school day for many children, while other agencies were saying to have normal school while wearing masks. And so many parents and people in the public were concerned about what was going to happen, and the unclarity of the whole situation is what caused this lack of trust. And this lack of trust is what brings to the next point about there being other groups that are independent and more reliable than the CDC to give out this information. The COVID Rapid Response Working Group at Edmund J. Safford Center was one of the several independent organizations that stepped in and helped to fill in missing information. The New York Times stated that these groups, run mostly out of academic centers and private foundations, have transformed reams of new raw data on transmission rates, hospital rates, and death tolls. This new information has come to the public in a more reliable way that allows to turn data to be put into actionable intelligence that gives more people trust and allows for more things to be done against the pandemic to allow to save more lives and allow more people to hear this information from a news source that can bring on more followers. And so have we, now that we've seen how the CDC has been having a lack of trust due to their political overview of their articles and reviews, not having consistent information and confusion, and as well as not being as reliable or accurate as other companies, we can see why the CDC is not to be trusted. Because during a global pandemic such as this one today, we do not want to be playing around with a company that cannot give out reliable information. Because the more days that the information is not there, the more days that there are people who could be losing their lives to something that could be helped and prevented.